Question 1. Governance review demonstrates that a certified dialectical behavior therapy, CDBT, professional working in a community with significant cultural stigma surrounding mental health is experiencing low engagement with their services. The professional is considering how to best address this barrier to care. Which of the following strategies is most aligned with best professional practice and ethical guidelines for CDBT professionals in this context? Option A. Focus on individual therapy sessions, emphasizing the confidentiality and efficacy of DBT, assuming that clients will eventually overcome their cultural reservations as they experience therapeutic benefits. Option B. Initiate a community-wide awareness campaign in partnership with local cultural leaders and elders to destigmatize mental health and promote the benefits of seeking support, while simultaneously adapting DBT interventions to be culturally sensitive. Option C. Implement standard, unmodified DBT protocols and educate clients on the universality of mental health challenges, expecting that cultural differences will naturally diminish with exposure to evidence-based treatment. Option D. Directly challenge cultural beliefs that contribute to stigma during therapy sessions, framing these beliefs as irrational and detrimental to individual well-being. Correct answer is B. Initiate a community-wide awareness campaign in partnership with local cultural leaders and elders to destigmatize mental health and promote the benefits of seeking support, while simultaneously adapting DBT interventions to be culturally sensitive. Explanation. This scenario presents a professional challenge due to the pervasive nature of cultural stigma surrounding mental health within the community served by the Certified Dialectical Behavior Therapy, CDBT, professional. Navigating this stigma requires a nuanced understanding of cultural values, beliefs, and historical contexts that may influence help-seeking behaviors and perceptions of mental illness. The CDBT professional must balance the imperative to provide effective, evidence-based DBT interventions with the need to be culturally sensitive and avoid inadvertently reinforcing existing stigmas. Careful judgment is required to ensure that therapeutic approaches are both clinically sound and culturally appropriate, fostering trust and engagement rather than alienation or mistrust. The correct approach represents best professional practice because it prioritizes a culturally informed and collaborative strategy. By engaging community leaders and elders, the CDBT professional demonstrates respect for existing social structures and leverages trusted voices to advocate for mental health awareness and services. This approach aligns with ethical guidelines that emphasize cultural competence and the importance of community engagement in mental health service delivery. It also reflects best practices in public health and community psychology, where understanding and working within the cultural context is crucial for program success and reducing barriers to care. This method is proactive in addressing stigma at its source and building a foundation of understanding and acceptance. An incorrect approach that focuses solely on direct, individualistic therapeutic interventions without addressing the broader cultural context fails to acknowledge the systemic nature of stigma. This approach risks alienating individuals who may fear judgment from their community or family, thus exacerbating the problem rather than solving it. Ethically, this could be seen as a failure to provide culturally competent care, as it does not adequately consider the client's social environment and its impact on their mental well-being. It may also violate principles of beneficence by not maximizing the potential for positive outcomes due to unaddressed external barriers. Another incorrect approach that involves imposing westernized mental health models without adaptation or consultation with the community is likely to be met with resistance and misunderstanding. This can be perceived as culturally insensitive and disrespectful, further entrenching negative perceptions of mental health services. Regulatory and ethical frameworks for CDBT professionals mandate cultural humility and adaptation of interventions to be effective and respectful. Such an approach would likely fail to meet these standards, potentially leading to a breach of trust and a lack of engagement from the community. A further incorrect approach that dismisses or minimizes the impact of cultural stigma, viewing it as an individual rather than a community issue, is a significant professional and ethical failing. This perspective ignores the profound influence of social norms and cultural beliefs on mental health perceptions and help-seeking behaviors. It demonstrates a lack of cultural competence and an inability to provide holistic care that considers the client within their broader social context. This approach would not only be ineffective, but could also be harmful, as it fails to address the root causes of barriers to mental health support. The professional decision-making process for similar situations should involve a thorough cultural assessment of the community, including identifying key stakeholders, understanding prevailing beliefs about mental health, and recognizing existing support systems. This should be followed by a collaborative approach to developing and implementing interventions, ensuring that the CDBT professional acts as a facilitator and partner rather than an external authority. Prioritizing building trust, demonstrating cultural humility, and adapting evidence-based practices to be culturally relevant are paramount. Continuous evaluation of the cultural appropriateness and effectiveness of interventions is also essential. Question 2. Market research demonstrates that clients often present with a complex interplay of distress, sometimes making it challenging to discern the most immediate therapeutic priority. A certified dialectical behavior therapy, CDBT, professional is working with a client who expresses significant distress about interpersonal relationship difficulties and a desire to improve their social skills. However, the client also has a history of suicidal ideation and has recently experienced a relapse in substance use. In this context, which of the following best reflects the application of the DBT treatment hierarchy? Option A. Prioritize addressing the client's suicidal ideation and substance use relapse, as these represent life-threatening behaviors that fall at the highest level of the DBT hierarchy, before focusing on interpersonal relationship difficulties. Option B. Focus on improving the client's social skills and interpersonal relationships, as these are the client's stated priorities and addressing them may indirectly reduce overall distress. Option C. Engage in a discussion with the client about which issue they feel is most pressing, allowing their immediate emotional state to dictate the order of intervention. Option D. Immediately refer the client to a substance abuse specialist and a psychiatrist for separate treatment of their substance use and suicidal ideation, while continuing to address interpersonal issues in DBT. The correct answer is A. Prioritize addressing the client's suicidal ideation and substance use relapse, as these represent life-threatening behaviors that fall at the highest level of the DBT hierarchy, before focusing on interpersonal relationship difficulties. Explanation. This scenario presents a common challenge in dialectical behavior therapy, DBT, practice, ensuring adherence to the treatment hierarchy while managing client crises. The hierarchy is a foundational element of DBT, designed to prioritize interventions based on their urgency and impact on client safety and treatment engagement. Deviating from this hierarchy without proper justification can lead to a breakdown in treatment structure, potentially exacerbating client distress and undermining therapeutic progress. Professionals must exercise careful judgment to balance the immediate needs of a client with the established principles of DBT. The correct approach prioritizes safety and treatment adherence by addressing the most urgent issues first, as dictated by the DBT hierarchy. This involves a structured assessment of the client's current state, focusing on life-threatening behaviors, therapy-interfering behaviors, and quality-of-life interfering behaviors, in that order. By systematically working through the hierarchy, the therapist ensures that critical issues are not overlooked and that the treatment remains focused and effective. This aligns with best practices in DBT, which emphasize a structured and hierarchical approach to intervention to maximize client safety and therapeutic outcomes. Adherence to the hierarchy is a core tenet of DBT, ensuring that the most severe problems are addressed before moving to less critical ones, thereby promoting stability and progress. An incorrect approach that bypasses the established hierarchy to address a less critical issue, even if presented as a significant concern by the client, fails to uphold the core principles of DBT. This can lead to a diffusion of therapeutic effort and may inadvertently reinforce less urgent behaviors, while more dangerous ones remain unaddressed. Ethically, this could be viewed as a failure to provide appropriate care by not prioritizing the most severe risks. Another incorrect approach might involve a rigid adherence to the hierarchy that fails to acknowledge the interconnectedness of behaviors or the potential for a seemingly less critical issue to escalate into a life-threatening one. This rigidity can be counterproductive and may lead to client disengagement if their immediate distress is not adequately acknowledged within the therapeutic framework. A third incorrect approach might involve delegating the management of a crisis situation outside the established DBT framework without proper consultation or a clear rationale, potentially leading to fragmented care and a lack of consistent therapeutic direction. Professional decision-making in such situations requires a thorough understanding of the DBT hierarchy and its application. Therapists must be skilled in assessing the severity and imminence of various behaviors. When faced with a complex presentation, the decision-making process should involve 1. A rapid assessment of the client's current state against the DBT hierarchy. 2. Consultation with supervisors or peers if uncertainty exists. 3. A clear rationale for any deviation from the standard hierarchy. And 4. Documentation of the assessment and intervention plan. The goal is always to maintain the integrity of the DBT treatment model while ensuring client safety and promoting therapeutic progress. Question 3. Cost-benefit analysis shows that while immediate symptom relief can be achieved through supportive listening and reassurance, the long-term benefit of building emotional resilience in clients experiencing significant distress is best served by a structured approach. A certified dialectical behavior therapy, CDBT, professional is working with a client who is experiencing intense emotional pain and expressing a desire for immediate relief. Which of the following therapeutic responses best aligns with the principles of building emotional resilience within the CDBT framework? Option A. Immediately introduce advanced emotion regulation skills, explaining their long-term benefits, while gently but firmly redirecting the client away from dwelling on their current intense feelings. Option B. Validate the client's current emotional experience, express empathy, and then collaboratively introduce and practice specific distress tolerance skills to manage the immediate intensity of their emotions, while also framing these skills as foundational for long-term emotional regulation. Option C. Focus exclusively on validating the client's current emotional experience and offering comfort, assuring them that the intense feelings will eventually pass without introducing specific coping mechanisms. Option D. Suggest that the client's current distress is a temporary phase and encourage them to engage in distracting activities until the intensity subsides, without further therapeutic intervention on emotional processing. The correct answer is B. Validate the client's current emotional experience, express empathy, and then collaboratively introduce and practice specific distress tolerance skills to manage the immediate intensity of their emotions, while also framing these skills as foundational for long-term emotional regulation. Explanation. This scenario presents a professional challenge because it requires a certified dialectical behavior therapy, CDBT, professional to balance the immediate need for symptom relief with the long-term goal of building robust emotional resilience in a client. The client's distress is palpable, creating pressure to intervene quickly with strategies that might offer temporary comfort but not necessarily foster lasting coping mechanisms. The CDBT professional must navigate this pressure while adhering to the ethical principles and practice guidelines that underpin CDBT, which emphasize skill building and self-efficacy. The correct approach represents best professional practice because it prioritizes the core tenets of dialectical behavior therapy: validation, skill acquisition, and dialectics. By validating the client's current emotional state, while simultaneously introducing and practicing distress tolerance skills, the CDBT professional is actively working towards building emotional resilience. This approach aligns with the CDBT framework's emphasis on empowering clients to manage their emotions effectively in the long term, rather than solely alleviating immediate discomfort. This is ethically sound as it respects client autonomy and promotes their capacity for self-management, a key objective in therapeutic interventions. An incorrect approach that focuses solely on immediate symptom reduction without introducing skills for future management would be ethically problematic. It could foster dependency on the therapist for emotional regulation, undermining the CDBT goal of client empowerment and self-efficacy. This could be seen as a failure to provide comprehensive care and a potential violation of the professional obligation to equip clients with sustainable coping strategies. Another incorrect approach that dismisses or minimizes the client's current distress in favor of solely focusing on future skill building would also be ethically unsound. This would fail to provide adequate validation, a cornerstone of DBT, and could alienate the client, hindering the therapeutic alliance. It would also neglect the immediate need for support, potentially exacerbating the client's distress. The professional decision-making process for similar situations should involve a careful assessment of the client's immediate needs and their capacity for skill acquisition. It requires a dialectical approach, acknowledging and validating the present distress, while strategically introducing and practicing skills that build long-term resilience. The CDBT professional must continuously assess the client's progress and adjust interventions to ensure both immediate support and the development of enduring emotional regulation skills, always in alignment with CDBT principles and ethical guidelines. Question 4. Assessment of a client experiencing a sudden surge of intense anger, characterized by shouting and agitated movements, requires a CDBT professional to implement immediate strategies. Which of the following represents the most effective and ethically sound approach for managing this intense emotional state? Option A. Instruct the client to immediately stop shouting and calm down, emphasizing the need for rational thought. Option B. Allow the client to continue expressing their anger without interruption until they naturally subside. Option C. Validate the client's feelings of anger and then guide them through a distress tolerance skill, such as the TIP skill, to reduce physiological arousal. Option D. Focus solely on identifying the cognitive distortions that are fueling the anger without addressing the immediate emotional intensity. The correct answer is C. Validate the client's feelings of anger and then guide them through a distress tolerance skill, such as the TIP skill, to reduce physiological arousal. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent volatility of intense emotions and the potential for rapid escalation. A certified dialectical behavior therapy, CDBT, professional must navigate the delicate balance between validating the client's distress and implementing effective emotion regulation strategies without inadvertently reinforcing maladaptive coping mechanisms or compromising safety. The urgency of the situation demands immediate, yet measured, intervention. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes immediate de-escalation while simultaneously introducing and reinforcing DBT skills. This aligns with the core principles of DBT, which emphasize acceptance and change. By validating the client's experience, "I hear how overwhelming this is for you," the professional establishes rapport and reduces defensiveness. Simultaneously, guiding the client through a specific DBT skill, such as distress tolerance techniques, e.g., TIP skills distraction, provides a concrete, actionable tool to manage the immediate intensity. This approach is ethically sound as it prioritizes client well-being and safety, and it is professionally justified by the CDBT framework, which mandates the application of evidence-based DBT intervention for managing intense emotions. Incorrect approaches analysis. One incorrect approach would be to solely focus on cognitive restructuring without acknowledging the intensity of the emotion. This fails to validate the client's experience, potentially leading to increased distress and a sense of being misunderstood, which is contrary to DBT's emphasis on acceptance. Ethically, this could be seen as a failure to provide appropriate care by neglecting a crucial component of emotional regulation. Another incorrect approach would be to simply instruct the client to calm down without providing any specific skills or support. This is dismissive and unhelpful, as individuals experiencing intense emotions often lack the immediate capacity to self-regulate without guidance. This approach violates the professional responsibility to provide effective interventions and could be considered a breach of ethical practice due to its ineffectiveness and potential to exacerbate the client's distress. A third incorrect approach would be to allow the client to fully express their intense emotions without any intervention or guidance towards regulation. While validation is important, unchecked emotional expression can lead to further dysregulation, potential harm to self or others, and can reinforce maladaptive patterns. This approach fails to meet the professional obligation to guide clients towards healthier coping mechanisms and could be ethically problematic if it leads to negative consequences for the client. Professional reasoning. Professionals should approach such situations by first assessing the immediate safety and intensity of the emotion. The next step is to employ validation to build rapport and create a receptive environment. Following validation, the professional should then introduce and guide the client through a relevant DBT skill, tailoring the choice of skill to the specific emotion and context. This iterative process of validation and skill application is central to effective DBT practice for managing intense emotions. Question 5. Comparative studies suggest that clients experiencing acute suicidal ideation often benefit from a structured approach that integrates learned distress tolerance skills with immediate safety measures. A certified dialectical behavior therapy, CDBT, professional is working with a client who is in significant emotional pain and expressing a desire to end their life. The client has previously learned several distress tolerance skills, including radical acceptance and self-soothing techniques. Which of the following represents the most appropriate course of action for the CDBT professional in this situation, adhering strictly to the regulatory framework for CDBT professionals? Option A. Engage the client in a collaborative safety planning process, assessing their current ability to utilize distress tolerance skills and developing a concrete plan for managing the immediate crisis, including identifying support systems and outlining steps to take if distress escalates. Option B. Advise the client to immediately practice all the distress tolerance skills they have learned until their distress subsides. Option C. Contact the client's parents and inform them of the client's suicidal ideation, requesting they come to the client's location. Option D. Immediately contact emergency services to have the client transported to the nearest hospital for psychiatric evaluation, without further discussion with the client. The correct answer is A. Engage the client in a collaborative safety planning process, assessing their current ability to utilize distress tolerance skills, and developing a concrete plan for managing the immediate crisis, including identifying support systems and outlining steps to take if distress escalates. Explanation. This scenario presents a professional challenge because the Certified Dialectical Behavior Therapy, CDBT, professional is faced with a client experiencing acute distress and expressing suicidal ideation, a situation that demands immediate and ethically sound intervention within the established regulatory framework for CDBT professionals. The professional must balance the client's immediate safety with their autonomy and the principles of DBT, particularly distress tolerance skills. The regulatory framework for CDBT professionals emphasizes adherence to ethical codes, client confidentiality, and the duty to protect, all while operating within the scope of practice. The correct approach represents best professional practice because it prioritizes immediate safety through a structured crisis intervention that incorporates DBT principles. This involves assessing the level of risk, engaging the client in a collaborative safety planning process that utilizes distress tolerance skills they have learned, and establishing clear follow-up protocols. This aligns with ethical guidelines that mandate professionals to take reasonable steps to prevent harm to themselves or others, and regulatory requirements that may stipulate reporting obligations in cases of imminent danger. The collaborative nature of safety planning respects client autonomy while ensuring their well-being. An incorrect approach that involves immediately escalating to emergency services without a thorough risk assessment and collaborative safety planning fails to fully utilize the client's learned distress tolerance skills and may undermine their sense of agency, potentially leading to increased distress or resistance. This could be considered an ethical failure in respecting client autonomy and a deviation from best practice in DBT, which aims to empower clients with coping mechanisms. Another incorrect approach, such as simply encouraging the client to use their skills without active engagement, assessment, or a concrete plan, is an ethical and professional failure. It neglects the professional's duty of care and the potential for the client's distress to overwhelm their current skill repertoire. This could be seen as a breach of professional responsibility and a failure to adequately address a crisis situation, potentially violating regulatory expectations for client safety. A third incorrect approach, such as breaching confidentiality by contacting family or friends without the client's consent, or a clear indication of imminent danger that necessitates such a breach, is a significant ethical and regulatory violation. Confidentiality is a cornerstone of therapeutic practice, and its breach must be justified by specific, legally defined circumstances, such as a direct threat of harm to a clearly identified individual. The professional decision-making process for similar situations should involve a systematic risk assessment, followed by a collaborative approach to safety planning that leverages the client's existing DBT skills. This includes active listening, validation, and a clear understanding of the client's current capacity to implement distress tolerance strategies. If the risk is deemed imminent and the client is unable to engage in safety planning, then appropriate escalation, such as involving emergency services or a crisis team, becomes necessary, always with an aim to maintain the least restrictive intervention possible while ensuring safety. Documentation of all assessments, interventions, and decisions is also a critical component of professional practice and regulatory compliance. Question 6. Market research demonstrates that clients struggling with unchangeable life circumstances often exhibit intense emotional distress and resistance to acknowledging the reality of their situation. A certified dialectical behavior therapy, CDBT, professional is working with a client who has experienced a significant loss that cannot be reversed. The client expresses profound anger and sadness, repeatedly stating, "It's not fair, and I can't accept this." Which of the following approaches best aligns with the principles of accepting reality and radical acceptance within the CDBT framework? Option A. Immediately challenge the client's perception of unfairness and insist that they must accept the situation as it is, emphasizing that dwelling on what cannot be changed is unproductive and a sign of resistance. Option B. Focus solely on teaching the client distress tolerance skills to manage their anger and sadness, without directly addressing the unchangeable nature of the loss or the concept of acceptance. Option C. Validate the client's intense emotions and the unfairness of the situation, while gently guiding them to acknowledge that, while the loss is deeply painful and cannot be changed, the focus can shift to accepting this reality to reduce suffering and explore coping strategies for the present. Option D. Agree with the client that the situation is indeed unfair and unchangeable, and spend the session exploring hypothetical scenarios where the loss could have been prevented, thereby validating their desire for a different reality. The correct answer is C. Validate the client's intense emotions and the unfairness of the situation, while gently guiding them to acknowledge that, while the loss is deeply painful and cannot be changed, the focus can shift to accepting this reality to reduce suffering and explore coping strategies for the present. Explanation. This scenario presents a professional challenge because the Certified Dialectical Behavior Therapy, CDBT, professional is faced with a client who is experiencing significant distress due to a situation that, from an objective standpoint, may be perceived as unchangeable. The core of the challenge lies in balancing the client's emotional experience with the DBT principle of radical acceptance. The professional must navigate the client's resistance to accepting reality without invalidating their feelings or pushing them towards premature or inauthentic acceptance. This requires a nuanced application of DBT skills, particularly those related to accepting reality, which can be emotionally taxing for both the client and the therapist. The correct approach represents best professional practice because it directly applies the DBT principle of radical acceptance in a way that is both compassionate and skill-based. By validating the client's emotional pain, while gently guiding them towards acknowledging the unchangeable aspects of their situation, the professional is fostering a space for genuine acceptance to emerge. This aligns with the ethical guidelines of CDBT professionals, which emphasize client-centered care, promoting emotional regulation, and facilitating adaptive coping mechanisms. The focus is on helping the client move from fighting reality to accepting it, thereby reducing suffering and opening pathways for problem-solving or emotional processing of the unchangeable. This approach respects the client's autonomy and their pace of emotional processing. An incorrect approach that involves immediately attempting to fix the unchangeable situation or dismiss the client's emotional distress would be a significant regulatory and ethical failure. Dismissing the client's feelings constitutes invalidation, a core concept that DBT aims to address. Attempting to fix the unchangeable situation is not only futile, but also sets the client up for further disappointment and reinforces a pattern of fighting reality. Ethically, this would violate the principle of beneficence by failing to provide effective treatment and potentially causing harm through invalidation and false hope. It also fails to adhere to the specific training and ethical standards of a certified DBT professional, which mandate the application of DBT principles, including radical acceptance. Another incorrect approach, such as insisting on a superficial or intellectual understanding of acceptance without addressing the emotional component, would also be professionally unacceptable. Radical acceptance in DBT is not merely an intellectual agreement, but an emotional and behavioral shift. Forcing this shift without adequate emotional processing or validation would be akin to the invalidation described above and would not lead to genuine acceptance. This would be a failure to adhere to the comprehensive nature of DBT treatment and its emphasis on emotional experience. The professional decision-making process for similar situations should involve a thorough assessment of the client's current emotional state and their capacity for engaging with radical acceptance. The professional should first validate the client's distress and the difficulty of their situation. Then, they should collaboratively explore the unchangeable aspects of the situation, using DBT skills like mindfulness to observe thoughts and feelings without judgment. The goal is to help the client distinguish between what can be changed and what cannot, and to foster a willingness to accept the latter, not as approval, but as a way to reduce suffering and move forward. This process requires patience, empathy, and a deep understanding of DBT principles. Question 7. To address the challenge of a client expressing intense emotional pain that leads to impulsive, self-harming behaviors, which of the following approaches best embodies the core principles of dialectical behavior therapy, DBT, in fostering both acceptance and change? Option A. Immediately confront the client about the harmful nature of their impulsive behaviors, emphasizing the negative consequences and demanding they stop. Option B. Validate the client's intense emotional pain and the underlying reasons for their distress, while also collaboratively exploring and teaching alternative non-harmful coping skills to manage these emotions. Option C. Focus exclusively on validating the client's emotional distress, assuring them that their feelings are understandable and that the behaviors are a natural consequence of such pain, without introducing skills for change. Option D. Dismiss the client's emotional expressions as an overreaction and focus solely on teaching them behavioral control techniques without acknowledging their underlying pain. The correct answer is B. Validate the client's intense emotional pain and the underlying reasons for their distress, while also collaboratively exploring and teaching alternative non-harmful coping skills to manage these emotions. Explanation. This scenario presents a common implementation challenge in dialectical behavior therapy, DBT, where a therapist must balance the core principle of validation with the need for behavioral change, particularly when a client's behavior is self-destructive or harmful. The professional challenge lies in navigating the inherent tension between accepting the client's emotional experience, validation, and guiding them towards more adaptive coping mechanisms. Misapplication of validation can inadvertently reinforce maladaptive behaviors, while insufficient validation can lead to client disengagement and a breakdown of the therapeutic alliance. Careful judgment is required to ensure that validation is genuine, specific, and paired with skillful guidance towards change, aligning with the ethical imperative to provide effective and safe treatment. The correct approach represents best professional practice because it demonstrates a nuanced understanding of DBT's core principles. Validation, in DBT, is not simply agreement or condones behavior. It is about acknowledging the client's emotional state and the logic behind their feelings and actions, even if the actions themselves are problematic. By validating the client's distress and the underlying reasons for their impulsive behavior, the therapist builds trust and rapport, making the client more receptive to learning and practicing new skills. This approach directly addresses the client's immediate emotional pain, while simultaneously opening the door for skills-based interventions, which is central to DBT's transdiagnostic model. This aligns with the ethical guidelines of providing competent and client-centered care, ensuring that the therapeutic relationship is a safe space for exploration and growth. An incorrect approach that focuses solely on validating the client's distress without addressing the harmful behavior fails to uphold the DBT principle of promoting change. This can lead to the therapist inadvertently reinforcing maladaptive coping mechanisms, which is ethically problematic as it hinders the client's progress and potentially prolongs their suffering. Another incorrect approach that immediately confronts the client's behavior without sufficient validation risks alienating the client, damaging the therapeutic alliance, and triggering defensiveness, thereby undermining the effectiveness of the therapy. This violates the ethical principle of beneficence and non-maleficence by failing to provide a supportive environment conducive to healing. A third incorrect approach that dismisses the client's feelings as invalid or attention-seeking is a direct contravention of the core principle of validation and is ethically unsound, as it demonstrates a lack of empathy and respect for the client's subjective experience. Professional decision-making in such situations requires a systematic approach. First, the therapist must accurately assess the client's emotional state and the function of their behavior. Second, They must apply the principle of validation by acknowledging and understanding the client's perspective, even if they do not agree with the behavior. Third, they must skillfully integrate validation with the DBT principle of change, introducing skills-based interventions or problem-solving strategies in a way that is sensitive to the client's current emotional state. This iterative process of validation and change-oriented intervention is fundamental to effective DBT practice. Question 8. The performance metrics show a consistent pattern across multiple clients where individual therapy sessions and phone coaching contacts reveal ongoing difficulties with the application of emotion regulation skills, despite repeated attempts at teaching and reinforcement. What is the most appropriate next step for the DBT team to address this systemic challenge? Option A. Therapists should focus solely on distress tolerance skills in individual therapy and phone coaching until the emotion regulation deficits appear to resolve spontaneously. Option B. Individual therapists should increase the frequency of individual therapy sessions and phone coaching contacts for these clients, focusing on more intensive repetition of existing skill teaching materials. Option C. The consultation team should dedicate a session to collaboratively analyzing the specific skill deficits observed, exploring potential reasons for the lack of skill acquisition, e.g., teaching methods, client barriers, therapist factors, and developing revised strategies for skill instruction and reinforcement in individual therapy and phone coaching. Option D. The consultation team should reduce its meeting frequency, as the individual therapists are expected to manage skill deficits within their direct client work. The correct answer is C. The consultation team should dedicate a session to collaboratively analyzing the specific skill deficits observed, exploring potential reasons for the lack of skill acquisition, e.g., teaching methods, client barriers, therapist factors, and developing revised strategies for skill instruction and reinforcement in individual therapy and phone coaching. Explanation. This scenario presents a common challenge in dialectical behavior therapy, DBT, practice, balancing the effectiveness of different treatment modes with resource limitations and client needs. The core difficulty lies in determining how to best allocate limited consultation team time when individual therapy and phone coaching sessions reveal a consistent pattern of skill deficits that are not being adequately addressed. This requires a nuanced understanding of the interconnectedness of the 4 DBT modes and their respective roles in promoting client progress and therapist competence. The correct approach emphasizes the consultation team's role in problem-solving and enhancing therapist effectiveness. When individual therapy and phone coaching highlight persistent skill acquisition challenges, the consultation team is the designated forum for therapists to collaboratively analyze these patterns, identify potential barriers to skill use, and develop more effective strategies for teaching and reinforcing skills. This aligns with the ethical imperative to provide competent care and to continuously improve therapeutic interventions. The consultation team's function is not merely to vent or share client information, but to actively engage in case conceptualization and treatment planning, thereby directly impacting the quality of individual therapy and phone coaching. This proactive, collaborative problem-solving is central to maintaining high standards of DBT practice and ensuring client safety and progress. An incorrect approach would be to solely focus on increasing the frequency of individual therapy or phone coaching, without a systematic analysis of why skills are not being learned or applied. This fails to address the root cause of the problem and can lead to therapist burnout and client frustration. Ethically, this represents a failure to adapt treatment to the client's specific needs and a potential misuse of resources. Another incorrect approach would be to reduce the consultation team's involvement, assuming the individual therapists can manage the skill deficits independently. This directly contravenes the foundational principle of DBT consultation teams, which is to provide essential support and guidance to therapists, thereby risking a decline in the quality of care delivered. It also fails to acknowledge the complexity of skill acquisition and the need for peer supervision in addressing challenging cases. Professionals should approach such situations by first recognizing the interconnectedness of the DBT modes. When a pattern emerges across individual therapy and phone coaching, the consultation team should be the immediate next step for collaborative analysis. The decision-making process should involve 1. Clearly articulating the observed skill deficits and their impact on client progress. 2. Utilizing the consultation team to brainstorm potential reasons for these deficits, e.g., Inadequate teaching, client barriers, therapist skill gaps. 3. Collaboratively developing revised strategies for skill teaching and reinforcement within individual therapy and phone coaching. And 4. Evaluating the effectiveness of these revised strategies over time. This iterative process ensures that treatment remains client-centered and evidence-based. Question 9. The monitoring system demonstrates that a certified dialectical behavior therapy, CDBT, professional is working with a client who is currently experiencing intense emotional dysregulation and reporting significant difficulty staying present. The client expresses feeling overwhelmed by their emotions and struggles to engage in even basic self-soothing. The professional needs to select an initial mindfulness exercise to help the client ground themselves and begin to build present moment awareness. Which of the following approaches best aligns with the principles of dialectical behavior therapy and ethical practice for a CDBT professional in this situation? Option A. Recommend the client immediately begin a complex visualization exercise involving imagining a peaceful place to escape their current distress. Option B. Suggest the client try to suppress their overwhelming emotions by focusing intensely on future goals and aspirations. Option C. Instruct the client to immediately engage in a 20-minute loving-kindness meditation to cultivate compassion for themselves and others. Option D. Guide the client through a brief, simple what skill exercise, focusing on observing their immediate sensory experience without judgment, such as noticing the feeling of their feet on the floor or the sounds in the room. The correct answer is D. Guide the client through a brief, simple what skill exercise, focusing on observing their immediate sensory experience without judgment, such as noticing the feeling of their feet on the floor or the sounds in the room. Explanation. Scenario analysis. This scenario presents a professional challenge where a certified dialectical behavior therapy, CDBT, professional must select the most appropriate mindfulness exercise for a client experiencing significant distress and difficulty with emotional regulation. The challenge lies in tailoring the intervention to the client's current state, ensuring it is both effective and ethically delivered within the scope of CDBT practice. The professional must consider the client's capacity for engagement, potential for overwhelm, and the core principles of DBT, particularly as they relate to mindfulness. Correct approach analysis. The correct approach involves selecting a mindfulness exercise that is foundational, accessible, and directly addresses the client's immediate need for grounding and present moment awareness without demanding complex cognitive processing or prolonged stillness. This aligns with the CDBT professional's ethical obligation to provide evidence-based interventions that are tailored to the client's individual needs and current functioning. The chosen exercise should be simple enough to be practiced even when distressed, thereby building the client's capacity for self-regulation and distress tolerance, which are cornerstones of DBT. This approach prioritizes client safety and efficacy, ensuring the intervention does not inadvertently increase distress. Incorrect approach is analysis. An incorrect approach would involve recommending a mindfulness practice that is too advanced or demanding for a client in acute distress. For example, suggesting a lengthy meditation requiring sustained focus or complex visualization could overwhelm the client, leading to frustration, a sense of failure, and potentially increased anxiety or avoidance of mindfulness altogether. This would represent a failure to adhere to the principle of doing what works, and could be considered a breach of professional competence if the intervention is not appropriately matched to the client's capacity. Furthermore, recommending an exercise that is not a recognized component of DBT mindfulness skills training, without proper justification and client consent, would deviate from established best practices and regulatory guidelines for CDBT professionals. Another incorrect approach would be to dismiss the client's distress and proceed with a standard mindfulness exercise without acknowledging or addressing the immediate emotional state, which would be ethically negligent and counterproductive to therapeutic goals. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's current emotional state, cognitive capacity, and readiness for specific interventions. This involves active listening, empathy, and a collaborative approach to goal setting. When selecting mindfulness exercises, professionals should consider the hierarchy of DBT mindfulness skills, starting with foundational practices like what skills, observing, describing, participating, and how skills, non-judgmentally, one mindfully, effectively, before progressing to more complex practices. The choice should always prioritize client safety efficacy, and the ethical imperative to do no harm. If a client is experiencing significant distress, the initial focus should be on grounding and stabilization, using simple, accessible mindfulness techniques. Professionals must also be prepared to adapt interventions based on client feedback and observed responses, demonstrating flexibility and a commitment to client-centered care. Question 10. The control framework reveals that a certified dialectical behavior therapy, CDBT, professional is tasked with guiding a client through the core principles of dialectical behavior therapy. Which of the following best encapsulates the foundational understanding of DBT as mandated by professional standards for effective client care? Option A. A rigid adherence to a single DBT skill module at a time, progressing sequentially without considering the client's immediate needs or dialectical balance. Option B. A comprehensive integration of the biosocial theory, the 4 skill modules: mindfulness, distress tolerance, emotion regulation, interpersonal effectiveness, and the dialectical stance of acceptance and change, applied within a structured therapeutic relationship. Option C. An approach that prioritizes acceptance of the client's current behaviors without actively promoting behavioral change strategies. Option D. A primary focus on teaching distress tolerance skills to immediately manage acute crises, with less emphasis on other DBT modules. The correct answer is B. A comprehensive integration of the biosocial theory, the 4 skill modules: mindfulness, distress tolerance, emotion regulation, interpersonal effectiveness, and the dialectical stance of acceptance and change, applied within a structured therapeutic relationship. Explanation. This scenario presents a challenge in applying the core principles of dialectical behavior therapy, DBT, within a regulated professional context, specifically concerning the ethical and legal obligations of a certified dialectical behavior therapy, CDBT, professional. The challenge lies in balancing the inherent dialectic of DBT acceptance and change with the strict adherence to professional standards and client welfare as mandated by regulatory bodies. A CDBT professional must navigate the complexities of client autonomy, therapeutic efficacy, and the duty of care, all while operating within the defined scope of practice and ethical guidelines. Correct approach emphasizes a comprehensive understanding of DBT's foundational elements, including its biosocial theory, the 4 skill modules: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness, and the importance of the therapeutic relationship. It recognizes that effective DBT requires a skilled application of these principles, tailored to the individual client's needs, and presented within a structured treatment plan. This approach aligns with best professional practice by prioritizing evidence-based interventions, client safety, and the maintenance of professional boundaries, all of which are implicitly or explicitly supported by the regulatory framework governing CDBT professionals. The focus is on the integrated application of DBT principles to foster both acceptance of the client's current state and the development of adaptive coping mechanisms, thereby promoting long-term well-being and functional improvement. An incorrect approach that focuses solely on one aspect of DBT, such as distress tolerance skills, without considering the broader therapeutic context or the client's overall presentation, fails to meet the comprehensive requirements of effective DBT. This could lead to superficial symptom management without addressing underlying issues, potentially violating the professional's duty to provide competent and thorough care. Another incorrect approach might overemphasize the acceptance component to the detriment of promoting change, which could inadvertently reinforce maladaptive behaviors and hinder client progress, thereby contravening the ethical imperative to facilitate positive client outcomes. A third incorrect approach might neglect the importance of the therapeutic relationship and the dialectical tension within it, leading to a rigid or ineffective therapeutic stance that fails to foster the trust and collaboration essential for DBT success. These failures represent regulatory and ethical breaches because they deviate from the established standards of practice for DBT, potentially compromising client welfare and the integrity of the profession. Professional decision-making in such situations requires a systematic process. First, a thorough assessment of the client's needs in presenting problems. Second, a clear understanding of the core principles and modules of DBT. Third, the development of a treatment plan that integrates these principles in a dialectical manner. Fourth, ongoing monitoring of client progress and adaptation of the treatment plan as needed. And finally, consultation with supervisors or peers when facing complex cases or ethical dilemmas, ensuring adherence to both therapeutic best practices and regulatory requirements. Question 11. Consider a scenario where a certified dialectical behavior therapy (CDBT) professional is conducting a session with a client who, during a discussion about interpersonal difficulties, expresses, "I just don't see the point anymore. I've been thinking about ending it all maybe tonight." What is the most appropriate immediate next step for the CDBT professional in terms of risk assessment? Option A. Acknowledge the client's feelings but state that you cannot discuss such topics further as it is outside the scope of your therapeutic focus. Option B. Immediately contact emergency services and inform them of the client's statement without further assessment. Option C. Immediately initiate a detailed inquiry into the specifics of the suicidal ideation, including the presence of a plan, intent, and access to lethal means. Option D. Reassure the client that things will get better and offer general relaxation techniques to help them calm down. The correct answer is C. Immediately initiate a detailed inquiry into the specifics of the suicidal ideation, including the presence of a plan, intent, and access to lethal means. Explanation. This scenario presents a professionally challenging situation due to the immediate and potentially escalating nature of a client's suicidal ideation. The Certified Dialectical Behavior Therapy (CDBT) professional is ethically and legally bound to prioritize the client's safety, while respecting their autonomy as much as possible within the confines of risk assessment. The core challenge lies in balancing the duty to protect with the client's right to self-determination, requiring a nuanced and evidence-based approach to risk assessment. The correct approach represents best professional practice because it directly addresses the immediate safety concern through a structured, evidence-based risk assessment process. This involves gathering specific information about the suicidal ideation, intent, plan, and access to means. This systematic evaluation is crucial for determining the level of risk and guiding subsequent interventions. In the context of CDBT, this aligns with the core principles of validation and problem-solving, aiming to de-escalate the crisis and collaboratively develop a safety plan. Regulatory frameworks and ethical guidelines for mental health professionals consistently emphasize the paramount importance of client safety, particularly in cases of suicidal risk. This approach ensures that interventions are proportionate to the assessed risk and are documented thoroughly, which is a standard requirement for professional practice and liability protection. An incorrect approach that involves immediately calling emergency services without a thorough risk assessment fails to uphold the principle of least restrictive intervention. While emergency services may be necessary, initiating this step prematurely can erode client trust, potentially escalate the situation by making the client feel unheard or coerced, and may not be the most effective intervention if the risk is manageable with other strategies. Ethically, this bypasses the professional's responsibility to conduct a comprehensive assessment and develop a tailored plan. It could be seen as a failure to adequately explore less intrusive options and a potential violation of client autonomy if not justified by an immediate, high-level risk. Another incorrect approach, such as dismissing the client's statements as attention-seeking behavior or simply offering general coping skills without a specific risk assessment, represents a severe ethical and professional failure. This dismissive stance directly contradicts the CDBT principle of validation and can be incredibly harmful to a client in crisis. It demonstrates a lack of clinical judgment and a failure to adhere to professional standards for managing suicidal ideation. Regulatory bodies would view this as gross negligence, potentially leading to disciplinary action, as it fails to meet the basic duty of care. Such an approach ignores the potential for serious harm and the client's expressed distress. A further incorrect approach, such as agreeing to keep the suicidal ideation a secret from others without a clear safety plan, is also professionally unacceptable. While confidentiality is a cornerstone of therapy, it is not absolute, especially when there is a clear and present danger to the client's life. Failing to implement appropriate safety measures, such as involving support systems or emergency services when indicated by the risk assessment, constitutes a breach of the duty to protect. This can have serious legal and ethical repercussions, as the professional has a responsibility to take reasonable steps to prevent harm. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and validation of the client's distress. 2. Conducting a comprehensive risk assessment, including ideation, intent, plan, and access to means. 3. collaboratively developing a safety plan based on the assessed risk, which may include increased contact, involving support systems, or, if necessary, emergency interventions. 4. Thorough documentation of the assessment, interventions, and rationale. 5. Consultation with supervisors or colleagues when uncertainty exists. Question 12. The investigation demonstrates that a certified dialectical behavior therapy (CDBT) professional is working with a client who has a history of multiple suicide attempts and recent expressions of hopelessness. The professional must determine the most appropriate approach to managing the client's risk. Which of the following approaches best reflects the definition and importance of risk assessment within the CDBT framework? Option A. Immediately initiating involuntary hospitalization procedures based on the client's history of attempts, without a current assessment of immediate risk. Option B. Relying solely on the client's current verbal assurances that they will not engage in self-harm, given the therapeutic alliance. Option C. Dismissing the client's expressions of hopelessness as a typical symptom of their disorder, focusing only on skill building. Option D. Conducting a thorough, multifaceted risk assessment that integrates current presentation, historical data, and client collaboration on a safety plan. The correct answer is D. Conducting a thorough, multifaceted risk assessment that integrates current presentation, historical data, and client collaboration on a safety plan. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of assessing risk in individuals with a history of self-harm and suicidal ideation, particularly within the context of dialectical behavior therapy, DBT. The core difficulty lies in balancing the imperative to provide effective, evidence-based treatment with the equally critical responsibility of ensuring client safety and adhering to professional ethical guidelines and regulatory frameworks. The DBT model itself emphasizes validation and acceptance, which can sometimes be misconstrued as minimizing risk. Therefore, a nuanced approach to risk assessment is paramount, requiring careful consideration of multiple factors beyond immediate presentation. Correct approach analysis. The correct approach involves a comprehensive, multifaceted risk assessment that integrates current client presentation, historical data, and the client's stated goals and motivations for treatment. This aligns with best professional practice as mandated by the Certified Dialectical Behavior Therapy (CDBT) professional standards, which emphasize a thorough understanding of the client's risk profile. Regulatory frameworks for mental health professionals typically require practitioners to conduct ongoing risk assessments, document their findings, and develop safety plans collaboratively with clients when indicated. This approach ensures that interventions are tailored to the individual's specific needs and risk level, promoting both therapeutic progress and safety. The importance of this approach lies in its proactive nature, aiming to identify potential risks before they escalate and to empower the client in their own safety management. Incorrect approach is analysis. One incorrect approach would be to solely rely on the client's current verbal assurances of safety without considering historical patterns of self-harm or suicidal ideation. This fails to acknowledge the cyclical nature of such behaviors and the potential for relapse, violating the ethical duty to protect vulnerable individuals. Regulatory bodies would view this as a failure to conduct a diligent and ongoing risk assessment. Another incorrect approach would be to immediately escalate to a higher level of care or involuntary hospitalization based on a single instance of expressed distress, without a thorough assessment of the immediate risk and the client's capacity for safety planning. This can undermine the therapeutic alliance, potentially alienate the client, and may not be the most effective intervention if the risk is manageable within an outpatient setting. Ethical guidelines and regulations often stress the least restrictive intervention necessary to ensure safety. A third incorrect approach would be to dismiss the client's expressions of distress as attention-seeking behavior or as a byproduct of their personality disorder, without a systematic evaluation of potential risk. This demonstrates a lack of empathy and a failure to adhere to the core principles of DBT, which advocate for validation and understanding. Such an approach would be a clear violation of ethical standards and potentially regulatory requirements concerning the duty of care. Professional reasoning. Professionals should approach risk assessment with a framework that includes 1. Gathering comprehensive information. This involves reviewing past records, conducting thorough clinical interviews, and utilizing validated risk assessment tools. 2. Identifying risk factors. This includes assessing the presence of suicidal ideation, intent, plan, access to means, history of attempts, impulsivity, substance use, and social support. 3. Evaluating protective factors. This involves identifying coping skills, support systems, reasons for living, and engagement in treatment. 4. Collaborating with the client. Safety planning should be a collaborative process, empowering the client and fostering their agency. 5. Ongoing reassessment. Risk assessment is not a one-time event, but an ongoing process that should be revisited regularly, and whenever there are significant changes in the client's presentation or circumstances. Documentation of this process is crucial for accountability and continuity of care. Question 13. Upon reviewing a client's progress in dialectical behavior therapy, a certified dialectical behavior therapy (CDBT) professional notes that the client has consistently failed to complete their diary cards for the past 3 weeks. The client reports feeling overwhelmed and unsure of what to write. Which of the following represents the most therapeutically appropriate and ethically sound initial response? Option A. Advise the client that diary cards are not essential for progress and suggest focusing on other DBT skills instead, effectively bypassing the tracking component. Option B. Insist that the client complete the diary cards as a mandatory component of therapy, explaining that non-compliance will hinder their progress and may lead to termination of services. Option C. Validate the client's feelings of being overwhelmed and collaboratively explore the specific barriers they are experiencing in completing the diary cards, offering to simplify the card or provide more direct guidance on its use. Option D. Immediately document the client's noncompliance as a sign of resistance and consult with a supervisor about potentially referring the client to a different therapist who can better manage their adherence to treatment protocols. The correct answer is C. Validate the client's feelings of being overwhelmed and collaboratively explore the specific barriers they are experiencing in completing the diary cards, offering to simplify the card or provide more direct guidance on its use. Explanation. This scenario presents a professional challenge because it requires a certified dialectical behavior therapy (CDBT) professional to balance the client's autonomy and the therapeutic alliance with the ethical imperative to ensure effective treatment and client safety. The use of diary cards is a core component of DBT, designed to facilitate self-monitoring, skill acquisition, and communication between sessions. The challenge lies in how to respond when a client consistently fails to complete these cards, which can indicate a range of issues from resistance to overwhelming distress, or a misunderstanding of the purpose of the cards. Careful judgment is required to avoid invalidating the client's experience while still upholding the integrity of the treatment protocol. The correct approach represents best professional practice because it prioritizes a collaborative and validating response. By first exploring the reasons behind the client's non-completion without judgment, the professional demonstrates respect for the client's current state and potential barriers. This approach aligns with DBT's emphasis on validation and problem solving. It allows the professional to understand the underlying issues, which might include difficulties with self-awareness, emotional dysregulation, impacting the ability to track, or external stressors. This understanding then informs a tailored strategy, which could involve simplifying the card, providing more explicit instruction, or addressing the emotional barriers directly. This is ethically sound as it upholds beneficence, acting in the client's best interest, and non-maleficence, avoiding harm by not imposing a potentially unhelpful or invalidating approach. An incorrect approach that involves immediately insisting on the completion of diary cards without exploration fails to acknowledge the client's potential distress or barriers. This can be perceived as punitive and invalidating, potentially damaging the therapeutic alliance and increasing client resistance, which is a failure to uphold the principle of non-maleficence. It also neglects the principle of beneficence by not adapting the treatment to the client's current needs. Another incorrect approach, such as dismissing the importance of diary cards altogether because the client is not completing them, undermines the core DBT protocol and the evidence-based rationale for their use. This could lead to a less effective treatment outcome and is a failure to provide competent care, violating professional standards. It also fails to address the potential underlying issues that are preventing completion, thus not acting in the client's best interest. A third incorrect approach, which involves reporting the client to a supervisor or referring them out solely based on non-completion of diary cards without attempting to understand or address the issue, is premature and potentially harmful. This fails to demonstrate due diligence in attempting to resolve therapeutic impasses and could be seen as abandoning the client without adequate support, violating ethical obligations to provide ongoing care. The professional decision-making process for similar situations should involve a stepped approach. 1. Acknowledge and validate the client's experience regarding the diary card completion. 2. Collaboratively explore the reasons for non-completion, focusing on understanding rather than blame. 3. Problem-solve collaboratively to identify strategies that make diary card completion more feasible and meaningful for the client. This might involve modifying the card, providing additional support, or addressing underlying emotional or practical barriers. 4. Reiterate the purpose and benefits of diary cards within the context of the client's treatment goals. 5. Document the process and any agreed-upon modifications or strategies. 6. If significant barriers persist despite collaborative efforts, consult with supervisors or peers to determine the next best steps, which might include further assessment or consideration of alternative therapeutic approaches if DBT is no longer deemed appropriate or feasible in its standard form. Question 14. The control framework reveals that when a certified dialectical behavior therapy, CDBT, professional encounters a client expressing intense emotional distress and engaging in maladaptive behaviors, which of the following approaches best leverages the therapeutic relationship to facilitate engagement with DBT skills and promote emotional regulation? Option A. Focus exclusively on teaching and reinforcing specific DBT skills, gently redirecting the client away from emotional expression towards practical problem solving. Option B. Actively validate the client's emotional experience, acknowledging the difficulty of their feelings, and collaboratively explore how DBT skills can help them navigate these emotions while maintaining clear professional boundaries. Option C. Minimize the client's emotional distress, framing it as an impediment to progress, and emphasize the need for immediate behavioral change to achieve therapeutic goals. Option D. Share personal anecdotes of similar struggles to build rapport and demonstrate empathy, encouraging the client to see that they are not alone in their difficulties. The correct answer is B. Actively validate the client's emotional experience, acknowledging the difficulty of their feelings, and collaboratively explore how DBT skills can help them navigate these emotions while maintaining clear professional boundaries. Explanation. The control framework reveals that in dialectical behavior therapy, DBT, the therapeutic relationship is not merely a conduit for skill delivery, but a foundational element that underpins the entire treatment process. This scenario is professionally challenging because it requires the certified dialectical behavior therapy, CDBT, professional to navigate the delicate balance between maintaining therapeutic boundaries and leveraging the relationship to foster trust, validation, and a sense of safety, which are crucial for clients to engage with challenging DBT skill and tolerate distress. The inherent vulnerability of clients in DBT, often grappling with intense emotions and maladaptive behaviors, necessitates a relationship characterized by unwavering acceptance and a commitment to the client's well-being, as mandated by the ethical guidelines governing CDBT professionals. The correct approach represents best professional practice because it prioritizes the client's emotional safety and the integrity of the therapeutic alliance. By actively validating the client's experience, even when their behavior is problematic, the CDBT professional demonstrates acceptance and builds a strong foundation of trust. This validation is not an endorsement of the behavior, but an acknowledgement of the client's internal emotional reality, which is a core DBT principle. This approach aligns with the ethical imperative to provide competent and compassionate care, ensuring that the client feels understood and supported, thereby increasing their willingness to engage in the therapeutic process and learn new coping mechanisms. The emphasis on collaborative problem-solving further reinforces the client's agency and the therapist's role as a supportive guide, consistent with the collaborative nature of DBT. An incorrect approach that focuses solely on immediate behavioral correction without acknowledging the underlying emotional distress fails to uphold the core tenets of DBT and ethical practice. This approach risks alienating the client, damaging the therapeutic relationship, and reinforcing feelings of shame or invalidation, which can exacerbate the very problems the client is seeking help for. Ethically, this would be a failure to provide client-centered care and a disregard for the importance of the therapeutic alliance in facilitating change. Another incorrect approach that involves oversharing personal experiences to foster connection, while potentially well-intentioned, crosses professional boundaries. This can blur the lines of the therapeutic relationship, shift the focus away from the client's needs, and introduce an imbalance of power. Ethically, this constitutes a breach of professional boundaries, potentially compromising the client's safety and the effectiveness of the therapy. It can also lead to the client feeling responsible for the therapist's emotional well-being, which is a significant ethical violation. A third incorrect approach that dismisses the client's emotional distress as a mere obstacle to skill acquisition fundamentally misunderstands the role of emotion in DBT. DBT posits that emotional dysregulation is central to many of the issues clients face. Ignoring or minimizing these emotions prevents the therapist from effectively addressing the root causes of the client's difficulties and hinders the client's ability to learn and apply DBT skills in a meaningful way. Ethically, this represents a failure to provide competent and evidence-based treatment, as it neglects a critical component of the DBT model. The professional decision-making process for similar situations should involve a continuous assessment of the client's emotional state, the dynamics of the therapeutic relationship, and the adherence to DBT principles and ethical guidelines. Professionals should ask themselves, is my response validating the client's experience while maintaining appropriate boundaries? Does this intervention strengthen or weaken the therapeutic alliance? Am I prioritizing the client's safety and well-being in accordance with ethical standards? This reflective practice, grounded in DBT theory and ethical codes, ensures that the therapeutic relationship remains a powerful tool for healing and growth. Question 15. Examination of the data shows a certified dialectical behavior therapy, CDBT, professional is working with a client who, when attempting to assert their needs in a role-play exercise, consistently uses a loud tone, direct accusations, and dismissive language towards the therapist acting as the interpersonal target. The client expresses frustration that their needs are not being met, but the aggressive delivery is causing the therapist to feel defensive and is unlikely to be effective in real-world interactions. Which of the following represents the most therapeutically sound and ethically appropriate approach for the CDBT professional to take in this moment? Option A. Acknowledge the client's strong emotions and frame their aggressive communication as a necessary, albeit intense, step in overcoming past passivity, encouraging them to continue expressing themselves forcefully. Option B. Continue with the role play without addressing the aggressive tone, assuming the client will eventually learn to modulate their behavior through continued practice of other DBT skills. Option C. Validate the client's underlying desire to have their needs met and their frustration, then collaboratively explore the impact of their current communication style and introduce specific DBT assertiveness skills like Dear MAN, focusing on respectful and effective expression. Option D. Immediately interrupt the client, label their communication as aggressive, and instruct them to stop, stating that this behavior is unacceptable in therapy. The correct answer is C. Validate the client's underlying desire to have their needs met and their frustration, then collaboratively explore the impact of their current communication style and introduce specific DBT assertiveness skills like Dear MAN, focusing on respectful and effective expression. Explanation. This scenario presents a common implementation challenge in assertiveness training within dialectical behavior therapy, DBT. The professional is faced with a client who is exhibiting a pattern of aggressive communication, which, while an attempt at assertiveness, is causing interpersonal distress and is not aligned with the DBT principle of effective and respectful communication. The challenge lies in guiding the client to differentiate between aggression and assertiveness without invalidating their efforts or discouraging their engagement in skill building. Careful judgment is required to ensure the intervention is therapeutic, ethical, and adheres to the principles of DBT as outlined by the Certified Dialectical Behavior Therapy, CDBT, professional framework. The correct approach involves a nuanced intervention that acknowledges the client's desire to be heard and respected, while gently but firmly redirecting their communication style. This aligns with best professional practice by employing validation of the client's underlying emotional state and intent, e.g., wanting to be heard, before introducing corrective feedback. The therapist would then collaboratively explore the impact of their aggressive communication on others and introduce specific DBT assertiveness skills, such as Dear Man, describe, express, assert, reinforce, mindful, appear open, negotiate, focusing on clear, direct and respectful expression of needs and boundaries. This approach is ethically sound as it prioritizes client well-being, promotes skill acquisition, and maintains a therapeutic alliance, all within the scope of CDBT professional practice. An incorrect approach would be to immediately label the client's behavior as aggressive and demand they stop, without any validation or exploration of the underlying intent. This could lead to client defensiveness, a breakdown in the therapeutic alliance, and a failure to teach effective skills. Ethically, this approach could be seen as invalidating and potentially harmful, as it dismisses the client's efforts and may increase their feelings of shame or inadequacy. It also fails to meet the professional standard of providing evidence-based interventions tailored to the client's specific needs and skill deficits. Another incorrect approach would be to simply ignore the aggressive communication and continue with other DBT skills without addressing the immediate interpersonal impact. This would be a failure to address a critical barrier to effective functioning and would not be in the client's best interest. Ethically, this constitutes a lapse in professional responsibility to address maladaptive behaviors that are hindering the client's progress and causing harm. A third incorrect approach might be to overvalidate the aggressive behavior, framing it as a necessary step in overcoming passivity. While acknowledging the client's desire for change is important, condoning aggression would violate the core principles of DBT and ethical practice, as it can lead to further interpersonal conflict and distress for the client and those around them. This would be a misapplication of validation and a failure to uphold professional standards regarding promoting healthy interpersonal functioning. The professional decision-making process for similar situations should involve a multi-step approach. 1. Validate the client's underlying emotion or intent, e.g., I hear that you're feeling frustrated and want to be heard. 2. Gently identify the impact of the current communication style without judgment, e.g., when communication is delivered in that tone, it can sometimes make it difficult for others to hear your message. 3. Collaboratively explore alternative, more effective communication strategies, drawing on specific DBT skills like Dear MAN. 4. Practice these skills in session, providing feedback and reinforcement. 5. Continuously assess the client's progress and adjust the intervention as needed, always prioritizing a safe and supportive therapeutic environment. Question 16. Performance analysis shows a client engaging in recurrent self-harm behaviors. The CDBT professional has conducted initial assessments and is now focusing on a detailed behavioral analysis to inform treatment planning. Which of the following approaches to understanding the self-harm behavior is most aligned with the principles of dialectical behavior therapy and best professional practice for a certified dialectical behavior therapy, CDBT professional? Option A. Systematically mapping out the sequence of events leading up to, during, and immediately following the self-harm, identifying specific thoughts, emotions, physical sensations, and environmental triggers, as well as the short-term relief or consequence experienced to pinpoint functional relationships and intervention targets. Option B. Interpreting the self-harm as a direct manifestation of an underlying, unexpressed trauma and designing interventions solely around uncovering and processing this presumed trauma without a detailed behavioral analysis of the current self-harm cycle. Option C. Focusing primarily on the client's stated desire to stop the behavior, assuming that this motivation alone will drive the necessary changes without needing to dissect the specific behavioral chain. Option D. Applying a standardized set of DBT skills to all clients who self-harm, regardless of the specific triggers, or maintaining factors identified in their individual behavioral chains, believing that consistent application of skills will eventually lead to improvement. The correct answer is A. Systematically mapping out the sequence of events leading up to, during, and immediately following the self-harm, identifying specific thoughts, emotions, physical sensations, and environmental triggers, as well as the short-term relief or consequence experienced to pinpoint functional relationships and intervention targets. Explanation. This scenario is professionally challenging because it requires the Certified Dialectical Behavior Therapy, CDBT, professional to navigate the complexities of a client's self-harm behavior through the lens of behavioral analysis and chain analysis, while adhering strictly to the ethical guidelines and regulatory framework governing CDBT practice. The core challenge lies in accurately identifying the functional relationships between antecedents, behaviors, and consequences, and then translating this analysis into effective, Ethical interventions that respect client autonomy and safety. The CDBT professional must balance the immediate need for safety with the long-term goal of skill development and emotional regulation, all within the established scope of practice. The correct approach represents best professional practice because it systematically applies the principles of behavioral analysis and chain analysis to understand the specific triggers, maintaining factors, and consequences of the client's self-harm. This detailed understanding allows for the identification of specific points of intervention within the behavioral chain, enabling the development of targeted skills and strategies to disrupt the cycle of self-harm. This aligns with the ethical imperative to provide evidence-based, client-centered care that prioritizes safety and promotes functional improvement. By focusing on the functional relationships, the CDBT professional is adhering to the core tenets of DBT and demonstrating competence in its application, as expected by the certification standards. An incorrect approach that focuses solely on immediate suppression of the behavior without understanding its function would be ethically problematic. This could lead to interventions that are not sustainable or that fail to address the underlying emotional dysregulation, potentially increasing the risk of relapse or the development of new maladaptive coping mechanisms. It would also fail to empower the client with the skills to manage their distress independently, which is a cornerstone of DBT. Another incorrect approach that involves making assumptions about the client's motivations or internal states without empirical behavioral data would be a violation of ethical practice. Behavioral analysis demands an objective, data-driven approach. Speculation without behavioral evidence is not only unscientific, but can also lead to misdiagnosis, ineffective treatment, and potential harm to the client. It also undermines the collaborative nature of DBT, where the client is an active participant in understanding their own behavior. A further incorrect approach that involves generalizing interventions from other clients or theoretical frameworks without a specific behavioral analysis of the current client's situation would be unprofessional. Each client's behavioral chain is unique, and interventions must be tailored to their specific context, triggers, and consequences. This lack of specificity can lead to ineffective treatment and a failure to meet the client's individual needs, violating the principle of providing competent and individualized care. The professional decision-making process for similar situations should involve a structured, systematic approach. First, the CDBT professional must prioritize safety by assessing the immediate risk of harm. Second, they must engage in a thorough behavioral analysis, including a detailed chain analysis, to understand the functional relationships of the target behavior. This involves gathering information about antecedents, the behavior itself, and consequences, both immediate and delayed. Third, based on this analysis, the professional should collaboratively develop an intervention plan that targets specific links in the behavioral chain, focusing on skill building and increasing the client's capacity for emotion regulation and distress tolerance. Finally, ongoing monitoring and evaluation of the intervention's effectiveness are crucial, with adjustments made as needed based on behavioral data and client feedback. This process ensures that interventions are evidence-based, ethically sound, and tailored to the individual client's needs. Question 17. The audit findings indicate that during a session focused on interpersonal effectiveness, a client expressed intense anger towards a colleague, stating, "They completely disrespected me, and I have every right to be furious." The therapist's response was noted as a point for review. Which of the following therapist responses best aligns with dialectical behavior therapy, DBT, best practices for interpersonal effectiveness? Option A. Acknowledge the client's feeling of anger and then gently guide them to explore the specific situation, their goals for the interaction, and what they might have done differently to achieve a better outcome. Option B. Advise the client on the most assertive ways to confront their colleague and express their anger forcefully to ensure their boundaries are respected in the future. Option C. Immediately tell the client that their anger is not justified and that they need to calm down, as anger is rarely a productive emotion in the workplace. Option D. Focus solely on the colleague's perceived disrespect, validating the client's anger as a natural and appropriate response to such treatment, without exploring the client's own actions or goals. The correct answer is A. Acknowledge the client's feeling of anger and then gently guide them to explore the specific situation, their goals for the interaction, and what they might have done differently to achieve a better outcome. Explanation. Scenario analysis. This scenario presents a challenge in balancing a client's immediate emotional distress with the long-term goals of dialectical behavior therapy, DBT, specifically within the interpersonal effectiveness module. The therapist must navigate the client's request for immediate validation of their anger, which could be interpreted as a reinforcement of maladaptive emotional responses, against the DBT principle of skillful communication and objective self-assessment in interpersonal interactions. The audit findings highlight a potential deviation from best practices in DBT, requiring careful consideration of how to respond to client distress while upholding therapeutic objectives. Correct approach analysis. The correct approach involves validating the client's emotional experience without necessarily endorsing the specific behaviors or interpretations that led to the anger. This aligns with DBT's emphasis on acceptance and change. Validating the emotion. I hear that you are feeling very angry, acknowledges the client's subjective reality, a core component of DBT. Subsequently, guiding the client to explore the situation objectively and identify their goals for the interaction. What were you hoping to achieve in that conversation? Shifts the focus towards interpersonal effectiveness skills. This approach promotes self-awareness, encourages the client to consider alternative responses, and reinforces the DBT goal of achieving desired outcomes through skillful means, rather than solely through emotional expression. This is best professional practice as it adheres to the DBT model's commitment to both validation and skill building, fostering a therapeutic alliance while promoting client growth. Incorrect approaches analysis. One incorrect approach would be to immediately dismiss the client's anger or tell them they shouldn't be angry. This fails to validate the client's emotional experience, which is a foundational element of DBT and can lead to client defensiveness and a breakdown in the therapeutic alliance. It also neglects the opportunity to explore the function of the anger and its impact on interpersonal effectiveness. Another incorrect approach would be to solely focus on the client's interpretation of the other person's actions without exploring the client's own role or their interpersonal goals. This can reinforce a victim stance and hinder the development of interpersonal effectiveness skills, as it does not encourage the client to consider their own agency and communication strategies. It also misses the opportunity to teach objective assessment of interpersonal situations. A third incorrect approach would be to offer advice on how to retaliate or express anger aggressively. This directly contradicts the principles of interpersonal effectiveness, which aim to help clients achieve their goals without damaging relationships or violating their own values. This approach would be ethically problematic as it could lead to harmful interpersonal consequences for the client. Professional reasoning. Professionals should approach such situations by first employing the DBT principle of validation to establish rapport and acknowledge the client's emotional state. Following validation, the therapist should then pivot to skill building, guiding the client through an objective assessment of the interpersonal situation, identifying their goals, and exploring effective strategies to achieve those goals. This process involves a continuous cycle of acceptance and change, ensuring that the client feels heard while also being empowered to develop more adaptive interpersonal behaviors. Question 18. Analysis of a certified dialectical behavior therapy, CDBT, professional conducting a skills coaching session where a client, while role-playing a distress tolerance skill, becomes overwhelmed with emotion and expresses a strong desire to stop the exercise. The client is visibly distressed, tearful, and states, "I can't do this right now, it's too hard." What is the most therapeutically appropriate and ethically sound response for the CDBT professional? Option A. Terminate the role-play abruptly and move on to discussing a different, less emotionally charged DBT skill to avoid further client distress. Option B. Immediately insist that the client continue the role-play to build resilience, explaining that discomfort is a necessary part of learning new skills. Option C. Provide constructive criticism on the client's execution of the skill during the role-play to help them identify areas for improvement, even if they are distressed. Option D. Validate the client's distress, offer a brief pause, and collaboratively decide with the client whether to continue the role-play with modifications, take a break, or shift focus temporarily. Correct answer is D. Validate the client's distress, offer a brief pause, and collaboratively decide with the client whether to continue the role-play with modifications, take a break, or shift focus temporarily. Explanation. This scenario presents a common challenge in dialectical behavior therapy, DBT skills coaching. balancing the need for effective skill acquisition with the client's emotional distress during role-playing. The Certified Dialectical Behavior Therapy, CDBT, professional must navigate this delicate balance while adhering to ethical guidelines and best practices for skills coaching. The correct approach prioritizes client safety and therapeutic alliance while still facilitating skill development. It involves validating the client's distress, offering a pause, and collaboratively deciding on the next steps. This aligns with the DBT principle of validation and the ethical imperative to avoid re-traumatization. It also reflects the professional standard of tailoring interventions to the client's current capacity, ensuring that skills coaching is a supportive, rather than punitive, process. The CDBT professional's role is to guide the client in learning and applying skills, not to push them beyond their current emotional tolerance, which could undermine the therapeutic relationship and hinder long-term progress. An incorrect approach that immediately pushes the client to continue despite significant distress fails to acknowledge the client's emotional state. This can be interpreted as invalidating, potentially damaging the therapeutic alliance and increasing the client's resistance to learning skills. Ethically, this approach could be seen as a failure to provide appropriate care and to protect the client from undue emotional harm. It also disregards the principle of working within the client's window of tolerance, a core tenet of trauma-informed care and effective DBT. Another incorrect approach, that of immediately terminating the role play and moving to a different topic without addressing the client's distress or exploring the difficulty, also represents a failure. While it avoids pushing the client, it misses a crucial learning opportunity. The client's distress during the role play is a signal that the skill may be challenging to implement in a high-emotion situation. By not exploring this, the CDBT professional fails to help the client understand the barriers to skill use and to collaboratively problem solve. This can lead to the client feeling unsupported in their struggle and may result in the skill not being effectively integrated into their repertoire. A third incorrect approach, that of criticizing the client's performance during the role play, is highly detrimental. This is invalidating and punitive, directly contradicting the supportive nature of skills coaching. It can lead to shame, defensiveness, and a complete shutdown of the learning process. Ethically, it is a gross violation of the professional responsibility to create a safe and supportive learning environment. The professional decision-making process in such situations should involve 1. Recognizing and validating the client's emotional response. 2. Assessing the intensity of the distress and its impact on the client's ability to engage. 3. Collaboratively deciding whether to pause, modify the role play, or take a break. 4. Exploring the client's experience of the difficulty to identify barriers and potential solutions. 5. Re-engaging with the skill practice in a way that is manageable for the client, reinforcing their capacity to learn and grow. Question 19. Compliance review shows a Certified Dialectical Behavior Therapy, CDBT, professional has been working with a client for several months. The client, who has expressed feelings of loneliness and a desire for connection, recently invited the therapist to a personal social gathering outside of scheduled therapy sessions. The client stated, "It would mean so much to me if you could come. It would feel like we're real friends." How should the CDBT professional respond to this invitation to best uphold ethical and professional standards? Option A. Immediately terminate therapy with the client, citing the boundary violation as a reason for the professional relationship's end. Option B. Gently decline the invitation, explaining that while the invitation is appreciated, maintaining professional boundaries is essential for the therapeutic relationship to remain effective and safe for the client's progress. Offer to explore the client's feelings about connection and friendship within the therapy session. Option C. Accept the invitation, attending the gathering briefly to show support, and then reiterating professional boundaries once therapy resumes. Option D. Suggest that the client attend the gathering alone and then discuss their experiences and feelings about it in the next therapy session. The correct answer is B. Gently decline the invitation, explaining that while the invitation is appreciated, maintaining professional boundaries is essential for the therapeutic relationship to remain effective and safe for the client's progress. Offer to explore the client's feelings about connection and friendship within the therapy session. Explanation. This scenario presents a common challenge in dialectical behavior therapy, DBT, practice, managing the dual demands of therapeutic alliance and maintaining professional boundaries, particularly when a client's personal life intersects with the therapeutic relationship. The Certified Dialectical Behavior Therapy, CDBT, professional is ethically and professionally obligated to uphold client confidentiality and avoid dual relationships that could compromise therapeutic effectiveness or exploit the client. The core of the challenge lies in the potential for the client's request to blur the lines between a therapeutic relationship and a personal friendship, which could lead to a compromised therapeutic environment, transference issues, and a violation of professional ethical codes. The correct approach prioritizes the client's well-being and the integrity of the therapeutic relationship by gently but firmly reinforcing professional boundaries. This involves acknowledging the client's feelings and the perceived connection, while clearly stating the professional limitations and the reasons for maintaining them. This aligns with the CDBT professional's ethical duty to avoid dual relationships and to ensure that the therapeutic space remains safe and objective for the client's progress. It demonstrates an understanding of DBT principles, such as validation, while also upholding the core tenets of professional conduct. An incorrect approach that accepts the invitation to a personal event, even with the intention of maintaining professionalism, creates an immediate dual relationship. This violates ethical guidelines that prohibit such relationships due to the inherent power imbalance and the potential for compromised objectivity. The professional's personal involvement could inadvertently influence therapeutic interventions, create pressure on the client to please the therapist in a non-therapeutic context, and erode the trust built within the therapeutic setting. Furthermore, it risks a breach of confidentiality if personal information is exchanged, or if the therapist is perceived as having a personal stake in the client's life outside of therapy. Another incorrect approach that involves abruptly terminating therapy without adequate exploration or referral is also professionally unsound. While setting boundaries is crucial, a sudden termination can be experienced as abandonment by the client, particularly if they are struggling with attachment issues or fear of rejection. This could be detrimental to their therapeutic progress and may even exacerbate their distress. Ethical practice requires a thoughtful and planned termination process, which includes exploring the reasons for the boundary conflict, attempting to resolve it if possible, and providing appropriate referrals if the therapeutic relationship can no longer be maintained effectively. A professional decision-making process in such situations should involve a careful assessment of the potential impact on the client and the therapeutic alliance. The CDBT professional should first validate the client's expressed desire for connection, then clearly and compassionately articulate the professional boundaries and the rationale behind them, emphasizing the importance of maintaining a therapeutic space free from dual relationships. If the boundary conflict cannot be resolved and continues to impede therapeutic progress, a structured and supportive termination process, including referrals to other qualified professionals, should be initiated. This systematic approach ensures that client welfare remains paramount while upholding professional integrity and ethical standards. Question 20. Strategic planning requires a nuanced understanding of how dialectical behavior therapy, DBT, has evolved. When considering process optimization for a DBT program, which historical perspective is most critical for ensuring fidelity to the core model and maximizing therapeutic effectiveness? Option A. Emphasizing the integration of elements from various contemporary therapeutic fads that have shown some popularity, regardless of their empirical alignment with DBT's foundational principles. Option B. Adapting DBT to incorporate techniques from unrelated therapeutic modalities that have demonstrated success in different clinical populations, without a clear rationale for their applicability to DBT's core targets. Option C. Prioritizing the original research and theoretical framework developed by Marsha Linehan, focusing on the biosocial theory of emotion dysregulation and the 4 core modules as the bedrock for any optimization efforts. Option D. Focusing primarily on streamlining administrative processes and reducing session lengths to improve client accessibility, even if it means sacrificing the depth of skills training or validation components. The correct answer is C. Prioritizing the original research and theoretical framework developed by Marsha Linehan, focusing on the biosocial theory of emotion dysregulation and the 4 core modules as the bedrock for any optimization efforts. Explanation. This scenario presents a professional challenge by requiring the Certified Dialectical Behavior Therapy, CDBT, professional to integrate historical understanding of DBT's development into current practice, specifically when considering process optimization. The challenge lies in discerning which historical influences are most relevant and ethically sound to inform modern therapeutic approaches, ensuring that optimization efforts do not inadvertently dilute or misrepresent the core principles established by Marcia Linehan. Careful judgment is required to balance innovation with fidelity to the evidence-based model. The correct approach represents best professional practice because it acknowledges the foundational role of Marcia Linehan's original research and theoretical framework in the development of DBT. Adhering to the historical trajectory of DBT, which emphasizes a biosocial theory of emotion dysregulation and a skills-based, multi-component treatment, ensures that process optimization efforts remain aligned with the empirically validated components of the therapy. This approach upholds the integrity of DBT as a specific, evidence-based treatment, which is crucial for maintaining professional standards and ensuring client safety and efficacy. Aligning with the ethical imperative to provide competent and evidence-based care as outlined in professional practice guidelines for CDBT professionals. An incorrect approach that focuses solely on adapting DBT to mimic other therapeutic modalities, without a clear understanding of DBT's unique historical development and theoretical underpinnings, would represent a significant ethical failure. This could lead to a dilution of core DBT principles, potentially rendering the treatment ineffective and misrepresenting its evidence base to clients and referring professionals. Such an approach would violate the ethical obligation to practice within the scope of one's expertise and to provide treatments that are demonstrably effective for the target population. Another incorrect approach that prioritizes superficial structural changes or the adoption of trendy, unvalidated techniques over the core, theoretical and empirical foundations of DBT would also be professionally unacceptable. This disregards the historical evolution of DBT, which was painstakingly developed and refined through rigorous research to address specific clinical needs. Failing to respect this history risks undermining the very mechanisms that make DBT effective, leading to suboptimal client outcomes and a breach of professional responsibility to adhere to evidence-based practices. A professional decision-making process for similar situations should involve a thorough review of the historical development and empirical validation of DBT. Professionals must critically evaluate proposed process optimizations by asking, does this change honor the biosocial theory? Does it maintain the balance of acceptance and change strategies? Does it align with the original research and subsequent refinements of DBT? This critical self-reflection, grounded in the historical and empirical evidence, ensures that any optimization efforts enhance, rather than compromise, the fidelity and effectiveness of dialectical behavior therapy.